Good morning. Today our discussion will be about the heartwarming effect of pet therapy on elderly. In the introduction, we're going to speak about many studies utilizing dog, cat, birds, robotic simulation of animal have tried to ascertain the health benefit of pet ownership or animal-assisted therapy in the elderly. Several small unblinded investigations outlined improvement in behavior in demented person given the treatment in the presence of animal. Studies piloting the use of animal in the treatment of depression, schizophrenia have yielded mixed results. Animal may provide intangible benefit to the mental health of older person, such as the relief of isolation, boredom, but these have not been formally studied. Several investigations of the effect of pets on physical health suggest animal can lower blood pressure and that the dog walker can increase their physical activity. Dog walking in epidemiological studies and few preliminary trials associated with lower complication risk among patients with cardiovascular disease. Pets may also have harm. They may be expensive, difficult to care for, their owner might fall, theoretically zoonotic infection and bites can occur, but how often this occurs in the context of pet ownership or assisted animal therapy is unknown. Despite poor methodological quality of the research, after decades of study, pet ownership and animal-assisted therapy are likely to continue due to positive objective feeling many people have toward the animal. An overview of this is 2/3 of U.S. household, close to half of elderly individual owns pet. Investigation involving pet and other animal attempting to improve the health of older individual and involved in many species, including dogs, cat, manufactured simulation of animal. In this paper, the evidence of impact of animal on health of elderly is assessed. Given the small number of published manuscripts, systemic review was not attempted. Rather, the studies considered were obtained by performing PubMed search using term including pets, elderly, animal assisted. Additional articles were obtained from the reference list of the original article found. The effect of animal of pet therapy on mental health. The most frequently studied use of animal with elderly participant has been to alleviate manifestation of cognitive disorders, such as agitation. All the studies were unblinded, and not all were controlled, but most, though not all, showed a small but statistically significant improvement in behavioral symptoms scores on the animal-assisted intervention. One trial, the sole study that used a bird, uniquely noted that animal conferred psychological benefit to cognitive unimpaired older individual. 144 persons without cognitive impairment in nursing home in Italy were exposed to either canary bird or a plant or both of them. The individual assigned to care for canary or plant were provided with care instruction and participated in a 3-month intervention, the details of which were not specified in a paper. Subject who cared for the bird had significantly better score at the end of the intervention on subscale psychological symptoms in the brief symptom inventory and LEPAD-2 short version, which subjects in the two other group did not. Petting an animal can cause the brain to release certain chemicals called endorphins. These chemicals counteract your body reaction to pain by causing sense of pleasure and well-being. This can help ease the depression. The Pet Partner is an organization that supports the use of pet animal therapy animal. They describe kinds of therapeutic interaction with animal-assisted activity, and animal-assisted therapies. The difference in the structure is in the structure of the interaction. Activity sessions will usually involve meet and greet with a number of people and animals. The meetings are unstructured and free from detailed goals. Therapy sessions are more formal and usually include sets of goals. Animal-assisted therapy does not yet have much clinical evidence to back its usefulness. However, large bodies of anecdotal evidence support it. Other investigations explored effect of animal on demented elderly individual. Dementia Unit for U.S. veteran piloted the use of pet dog to elicit for socialization. 12 demented patients exhibited significant large number of social behavior, such as smiling or speaking in the presence of dog, implying that the animal might create benefit apart from effect on cognition. Effect on cardiovascular disease. The most compelling evidence was that dog ownership and recreational physical activity, but the statement was that this benefit was not consistent and may only be by behavioral intention, motivation, social support, rather than directly due to dog ownership. The committee recommendations were that pet ownership, particularly dog ownership, may be the cause for a reasonable reduction in cardiovascular risk. But the pet adoption should not be done with the primary purpose of reducing cardiovascular risk. Given this background, this review will summarize existing evidence briefly and discuss the recent evidence of role of pets in cardiovascular risk, focusing on clinical cardiovascular disease, current finding on cardiovascular disease risk factor, depression, markers of stress, emotional attachment, immunoglobulins, and asthma. Some of the earliest reports relating health benefit of companion animals have been in patients who have survived coronary heart disease. Friedman et al. Looked at the effects of social isolation and social support in 92 white survivors of myocardial infarction or angina, and found that among pet owners, the one-year survival rate was 94% as compared to 72% among those who do not own pet. The author found that the benefit of pet ownership extended beyond physical activity among dog walkers. And the most dog therapy and blood pressure. Dog therapy encourages exercises. Owning a therapy dog may increase your inclination may increase your inclination to regular exercise and thus improve on motor skills. Taking an exercise buddy on daily routine walk keeps senior moving. It helps them to meet the minimum recommendation of healthy physical activity. By taking regular walk, it promotes health not only through exercise but through the outdoor adventure, and nature can facilitate happiness. Also, walks provide sense of accomplishment for the owner and purpose while strengthening bond between animal and human. You can read more about this in ways to integrate health exercise regimen in seniors. Pet therapy reduces physical pain. Therapy dogs, in particular animal-assisted therapy, help to release endorphin that cause lower perceived pain and stress, and that was proven in one study, which even showed that the benefit of dog therapy can extend to family and friend of the dog owner. Dog therapy can aid in self-esteem and self-worth. The ties created between human and dogs is one of the unconditional love. Responsibility and connection between dog and its owner also provide sense of reasons and motivation to senior. This promotes feeling of self-worth and value. Also, dog therapy aid in fine motor skills and improve recovery times. Interacting with animal releases the neurotransmitter in the brain and generally related to the emotional bond between them, and that promotes proper body function and rebuild the strength. Support patients with dementia. Dementia is the most prevalent as adult age and get older. The effect of dementia can be detrimental to seniors and make it very challenging on the family caregiver. Therapy dog can provide calming effect and improve mood for those with dementia-related illness like Alzheimer's. This is powerful because the tendency for seniors with dementia to be easily agitated and disturbed. Pet therapy will also aid in fine motor skill and improve recovery times. Interaction with animal releases that hormones in the brain, and that will promote body function and rebuild the strength. Also, it promotes communication. Dogs that have unique power to connect with animals. They have evolved to understand animal gesture and understand some voices and sounds. Because of this, older adults that have troubles communicating may find it easier to communicate with dogs. This is because they have the ability to listen but may not be able to respond. This can provide a unique opportunity of interaction between the pet and his owner. Pet therapy will minimize fatigue. Fatigue is commonly associated side effect of drug treatment and also different illnesses. Therapy dogs have been shown to reduce fatigue, keeping the patient invigorated. It can promote strength to overcome the challenges of illness and side effects of treatment. Having a dog to be a part of senior life can help improve their well-being and add a new meaning to their life. Because of the substantial health benefit that therapy animals provide, pet therapy is being increasingly utilized as part of health and well-being promotion. This includes from children to senior and everything in between. Being an animal and a dog owner help people to feel better, happier, healthier. You can learn more about this and other benefits for the series. This will conclude our presentation today, and I hope you enjoyed it as much as I enjoyed preparing it.